Today I am going to explain to you what polycystic ovarian syndrome is. Knowing what this condition is really helps you find out what sort of treatment to seek, how long to expect treatment, and what sort of life changes you need to make. The first important thing to know about polycystic ovarian syndrome is the name is wrong. Polycystic ovarian syndrome is the most common endocrine hormonal condition in women, yet it has a wrong name. When you hear the name polycystic ovaries, you automatically think the problem is in the ovaries, but that is completely incorrect. Polycystic ovarian syndrome is not an initial ovarian disorder. It is actually a metabolic disease. There is an inbuilt error in the metabolism of insulin or precursors that are involved in the metabolism of insulin in our body. The reason for this condition is not very well known. Like everything else, women's health, the science is limited and it's just emerging and increasing. The theory behind it is we think that humans were supposed to live in caves and go hunt and have berries for food. And yet we started civilization and we started growing grains and crops. And humans are one of the only animals who have actually changed their food chain. By changing our food chain, we got exposed to a lot of carbohydrates, more than what our body was actually designed to be able to tolerate. So in this process, some people mutated with natural selection and they were able to tolerate that levels of carbohydrates, and some people didn't. And natural selection, being natural selection, decides, okay, I'm going to stop the passing of this gene to the next generation. So how do we do that? Well, it's simple. Let's make the female infertile. So if you are exposed to some level of carbohydrates and you cannot metabolize it, if a normal body produces this much insulin to be able to metabolize those carbohydrates and keep the sugars at a normal level, a PCOS body produces this much amount of insulin because the insulin production is impaired. The quality or the amount is not working. So naturally, people develop insulin resistance. And insulin is a growth factor. It makes your fat cells grow. So as a result of the fat cells being growing, we get increased production of androgens, the male hormone, which comes from both the ovary and also from the peripheral tissue and also adrenal glands. So people with PCOS have higher level of testosterone, the male hormone, or actually higher sensitivity to the male hormone. So the male hormone levels might be completely normal on a blood test, but the sensitivity of the testosterone at the level of, for example, the hair follicle or skin would be different. So people will present with symptoms of high testosterone. What are those high testosterone symptoms? One, hair loss, hair shedding, thinning of hair, especially women get bitemporal hair thinning, so on the sides, so hormonal type hair loss, and also frontal recession. You get excess facial hair, the thick, dark hair on the face, like beard type sort of a hair. And also some women do get acne on the back especially, and centralized weight gain, mood changes. Some women explain to me that throughout the month they become a bit passive-aggressive or even moody, not able to tolerate stress levels very well. And these are main symptoms of PCOS. So when the weight goes up and the testosterone goes up, the balance between the brain hormones that control our ovaries goes out of balance. So in a general situation, in a woman, the two hormones that control the ovaries, the FSH and LH that come from the pituitary gland in the brain, need to have a balance to be able to ovulate. So the FSH is usually on the higher side than the LH, and the LH level only peaks mid-cycle to help ovulation. But in PCOS, it's different. There's a sort of a swap, and the LH goes really, really high and FSH remains low. So the ovaries are hyperstimulated all the time. So if you look at the ovaries, you see these ovaries with small structures that look like cysts that have grown in size and come to the surface of the ovary, but they're not released properly. These are your eggs. So depending on how many eggs you've got, or follicles, if I want to be more scientific, these grow in size because they're stimulated by the LH hormone, but they don't get released properly, or they sometimes do because there's always variations with the severity of the disease. So you can see there's no cysts in polycystic ovarian disease. This is follicles. These are your eggs. So if you're 25 and you have polycystic ovarian syndrome, you will show those eggs or follicles on an ultrasound if you're not on the oral contraceptive pill or blocking ovulation for any reason. But if you are 45 and your ovaries, your eggs are running out, you will not show those ovarian follicles, but it doesn't mean that your PCOS has gone away. So doing the ultrasound helps, but it is not a factor that will rule out the diagnosis. Actually, making a diagnosis for polycystic ovarian syndrome is a criteria-based diagnosis. So going back to the follicles, these follicles are all hyperstimulated at the surface of the ovary, and randomly they might get released or not released. So people get periods and menstrual cycles that are irregular. You might skip periods. You might not have a period for 2 or 3 months in a row, or you might have very long or short bleeding. So atypical bleeding. So this is polycystic ovarian syndrome, a diagnosis by criteria. So when a person comes to me for diagnosis of polycystic ovarian syndrome, I look at 3 criteria. 1, irregular menstrual cycles. 2, evidence of high testosterone, whether it's clinical or on their blood test. And 3, possible evidence of an ultrasound. So polycystic ovarian syndrome, in summary, is a metabolic genetic disease. When you have it for life. It's like the color of your eyes. And as I say, look at it like you are allergic to carbohydrates. It is a condition which is associated with poor metabolism of carbohydrates. Why? Well, tune into my next video so I can talk to you about the effects of incretins and other agents in the treatment and pathophysiology of PCOS.